Hello, this is Dr. Haddad, the Chief of Staff of Blue Health. I hope you're enjoying your summer and the Phase 3 reopening in our county. So far, so good at the hospital. We have not had any COVID patients for the past few weeks. It's been almost a couple of months, which is very good news. Having said this, the reason why the number of COVID patients has remained zero at the hospital is because the prevalence of COVID in the community has been low. And the reason for this is the collective effort of all of you combined to ensure that we keep this virus in check by following all the public health measures in terms of avoiding crowds, washing hands as much as possible, keeping physical distance from others 6 feet, staying within our bubbles, and using masks indoor when you can't physical distance. Currently, many of us are thinking about the school year and the fall. From a hospital standpoint, we have been planning for the fall and in anticipation of the flu season and a potential COVID resurgence. I hope we don't get a second wave, but you never know. We have to be ready, of course. As for the school reopening, which is an extremely important topic to all of us, many of us are parents considering sending back our kids back to school this fall. The first line of defense to protect our children and their teachers and all of us at home is to maintain a low prevalence of COVID-19 in the community. We can't let our guards down. I know the numbers are low now, but they can go up very quickly, as we've seen in Spain, France, Australia, and even New Zealand now. It doesn't take much, as it's a fairly contagious virus. In the meantime, we are relying on our public health unit and school boards to give us guidance about what to do in the fall and to ensure that the environment within the school system is safe. Our job as a community is to keep the number of COVID cases low as much as possible. Therefore, I'll continue to encourage all of us to maintain our 6-foot distancing from others, avoid crowds, washing hands as much as possible, and using non-medical mask indoors when shopping or being in public transport, etc. If we can be successful in avoiding a second wave, that will translate to a safer environment, both in the schools and also in our businesses. In the meantime, if you have an appointment at the hospital, please keep it. We can't predict the future, but for now the hospital is running at 100% capacity. So please continue to come into your appointments at the clinics or for tests or for procedures. Our diagnostic unit is very busy. CAT scans, MRIs, ultrasounds, mammography, etc. We're doing our best to catch up on the thousands of backlogged cases from March. We are at more than 100% now, actually trying to catch up. And our operating rooms are also back to 100%, back to pre-COVID levels. We'll see what the next few months hold, but we're keeping our fingers crossed and are maintaining our readiness just in case. In the meantime, please help us by continuing to observe all public health measures so we don't get a second wave of COVID. And actually, it's been shown that if we do this, that will also reduce the number of influenza in the community as well, since it's all spread the same way with droplets. Thank you, and hope you enjoy the rest of the summer, and we'll see you in September.